March is Traumatic Brain Injury Awareness Month. It's defined as an alteration in brain function caused by an external force. But the damage itself is not always obvious. Julie Musgrave has more on how TBI can happen and unlikely symptoms that you should be looking out for.
Brenda, thank you so much for joining us. Now, what exactly does traumatic brain injury mean?
Well, when we're thinking about traumatic brain injury, we have to think about the mechanism of injury. So it could be any traumatic mechanism to the body. That could be a car accident, it could be sports, it could be an assault, it could be a fall. Any mechanism of injury to the body doesn't have to directly involve an impact to the head with essentially one symptom. So those symptoms could include headache, dizziness, nausea, sensitivity to light or noise, could be trouble thinking or paying attention, sleep symptoms, even emotional symptoms. Any one symptom could last 30 seconds and go away, or it could last a lot longer, for weeks, months, years. The thing about the TBI diagnosis, it's never handed to us on a silver platter. It's never obvious. It's never clear. The really severe ones we know because we can see on a CT scan. But it really takes a skilled clinician to take the time to interview their patient, to really figure out what's going on and to look at the big picture.
I think a lot of people hear concussion and they think that probably is the end of it. But there's a lot more and a lot more research recently that goes into the depth of what TBI is. So why is it so important that we have that awareness?
It's so incredibly important. You know, when we're talking about a broken bone, you know, we know how that's going to heal every time, but the brain is so complicated and we know so much more about it, including how vulnerable the pediatric brain is. We know there's a critical developmental period between ages 9 and 12. And so kids that are in these high-risk activities early on in life, having these repeated injuries, it can leave long-term effects. And so one of the things I want parents to know today is that if your child is involved in any activities that could be considered high risk, like motocross, skateboarding, football, anything that's high risk to hit your head, those are things that they should be looking out for. They should be looking out for mood swings, mechanisms to the head where their child feels irritable or they have headaches and those kinds of things.
If parents are noticing those symptoms, what are some questions that they should be asking their doctor in order to advocate for their child?
Yeah, one of the first questions I would ask my primary care physician is, how much training do you have managing concussion? Do you know what a proper assessment is to evaluate and treat something like this? Because one of the things we don't want is if a child is having problems, that could be in school or it could be just in everyday life. If they're having difficulty, what we don't want to do is wait and see if this gets better. What we want to do is refer them for the proper assessment. It could be a rehabilitation professional like physical therapy, occupational therapy, or what I do, speech therapy, to further evaluate and assist them and treat the problems.
All right, good awareness, good information. Brenda, thank you.
Absolutely. My pleasure. Thanks.
You can watch MedWatch today on KC24, Saturday night at 7 o'clock. The program is in partnership with Community Medical Centers.